Hi, I'm Dale Alexander. I'd like to take a few minutes to fill you in on what's going on with your state health benefit plan for this next plan year. This year, open enrollment is from October 9th through November 9th. Don't forget, every year you will need to register on the state health website and create a new password before making your medical elections. After registration, you may go online as many times as you like, but the last confirmed election at the time open enrollment closes will be your election for the next plan year. Once you start your election online, be certain to continue through until you receive a confirmation page with a confirmation number indicating that you successfully completed your elections. You should print and keep a copy of the confirmation page, which will include your confirmation number, or at least write this number down. This number is proof of the election you made should there be a discrepancy between state health records and your election. Once open enrollment closes, there will not be an opportunity to make corrections. However, you may go online to view the election you made. Your state health benefit plan has some important changes to take note of. Let's dive in. The premium changes this year were the result of several factors. First, because current premiums for family plans do not reflect the true cost of insuring two adults, where spouses were covered, the rates were restructured to account for the second adult. As a result of the restructured rates, the spousal surcharge is being removed for 2013. So here's a coverage tip. If you and your spouse both work for a state health covered employer and have family coverage, it may be cheaper for one spouse to elect employee only and the other spouse to elect employee plus children. Again, this is a result of the restructuring of the rates, so please check to see if this impacts you. Also, you will notice premium differences between United Healthcare and Cigna. This reflects the difference in claims costs between the two carriers. There's good news from the state regarding the Peach Care for Kids program. If you qualify, Peach Care allows you to cover children for medical, dental, and vision care. The state has extended the application date until December 31st to apply for coverage without the required 6-month gap in coverage. If you apply for Peach Care, it's important that you receive approval from the state before removing your children from your current coverage. If you remove them during this open enrollment and your application is denied, you won't be able to re-enroll them until the open enrollment next year. More good news. A childhood obesity initiative has been formed. This will give children ages 3 through 18 with a diagnosis of obesity up to 4 primary care doctor visits, then up to 4 visits with a registered dietitian as determined by their physician. Also, under the Affordable Care Act, there is an expansion of women's preventive care coverage, which did contribute to an increase in your rates. A complete list of expanded services is available at healthcare.gov. Let's talk about the Wellness Promise. Over half of you enrolled in a wellness plan for 2012. Also, over half completed the Wellness Promise by taking the online health assessment and obtaining a biometric screening. Those of you who completed both portions of the promise are eligible to elect wellness for 2013. So who else is allowed in the wellness plan for 2013? A new employee whose coverage was effective January the 1st, 2012 or after didn't have the ability to elect the wellness plan. Now you can. And also those who specifically chose this standard plan for this past year and now want to elect the wellness plan, you can as well. If you or your covered spouse did not satisfy your wellness promise, you will not be offered a wellness plan for 2013. For the wellness plans, members must do several things to remain eligible in future years. First, take an annual online health assessment. Next, complete an online member education module, and have a biometric screening if you have not already had one. Please note that the deadline for all of these activities has changed to May 31st, 2013. So how do I find out if I have kept my wellness promise in 2012? This depends on your health plan, as each has different ways to do this. United Healthcare members can go online and check their promise status. Cigna members should have received a final compliance notification in the mail, but may also call the number on the back of your Cigna ID card. If the State Health Benefit Plan website does not display any 2013 wellness plan options for you, this indicates you or your covered spouse did not meet your 2012 wellness promise. If you believe you met the wellness promise, you may file a wellness appeal. The wellness appeal form is located on the State Health website, which can be accessed through your Employee Benefit Center. If you know that you or your covered spouse did not complete one or both of the wellness activities, there's no need to complete an appeal, as your appeal will not be approved. For future years, the wellness plan will move from a promise-based to a rewards-based system. Let me explain. All members and covered spouses enrolled in a 2013 wellness or standard plan option will each be eligible to earn a $240 HRA incentive contribution for 2014 if both complete the required wellness activities just mentioned. That could mean up to $480 in incentives. Additional details are available in the decision guide. Now, let's discuss the basic changes to each of the plans. The deductibles and out-of-pocket limits have increased on both the wellness and standard options for all plans. All plans still cover preventive services at 100% with no deductible. The high deductible health plan is still the lowest cost plan when you consider premiums and out-of-pocket amounts. With this plan, you have to meet the entire deductible before any reimbursement is made. After that, the plan pays 90% of covered in-network charges until you meet your out-of-pocket maximum. Prescriptions do apply toward the deductible with this plan. The HRA plan may be a good option for those who have low medical expenses. You must satisfy the deductible before any reimbursements are made, but the state-provided HRA credits will help you meet that deductible. For 2013, you won't receive any additional HRA credits for completing the health assessment and physical. Once the deductible has been met, the plan pays 85% of covered in-network charges until you meet your out-of-pocket maximum. Prescriptions do not apply toward the deductible in the HRA plan. The HRA credits provided for the standard plan have been significantly reduced. Although the HMO plan carries the highest premiums, it can be a good choice for those who want more predictability in the costs of their office visits and prescriptions, as the HMO plan has co-pays for these services. All other services apply toward the deductible, but co-pays do not go towards satisfying the deductible or out-of-pocket maximum. The office visit co-pays for the standard plan have increased $10. Once the deductible has been met, the plan pays 80% of covered in-network charges until you meet your out-of-pocket maximum. Remember, co-pays must still be paid even after the out-of-pocket maximum has been met. Please be sure to read the 2013 Employee Decision Guide before making your medical election for the upcoming plan year. This will provide details on what is changing and what effect the changes will have on benefits, options, rates, etc. The decision guide can be accessed through your Employee Benefit Center. Thank you for spending your valuable time with us. We appreciate all you do. Have a great open enrollment.